ഹലോ ഫ്രണ്ട്സ്, എല്ലാവർക്കും ഒരു പുതിയ വീഡിയോയിലേക്ക് സ്വാഗതം. 100 മൾട്ടിപ്പിൾ ചോയ്സ് ക്വസ്റ്റ്യൻസും അതിൻ്റെ ആൻസേഴ്സും വരുന്ന മൂന്നാമത്തെ സെറ്റാണിത് ഇന്നത്തെ വീഡിയോ. അപ്പോൾ എല്ലാവരും ലൈക്ക് ചെയ്യുക, ഷെയർ ചെയ്യുക, സബ്സ്ക്രൈബും കൂടി ചെയ്യുക. ഒത്തിരി എഫേർട്ട് ഇട്ടിട്ടാണ് ഓരോ വീഡിയോസും ചെയ്യുന്നത്. അപ്പോൾ എല്ലാവരും ഒന്ന് സപ്പോർട്ട് ചെയ്തേക്കും. വീഡിയോയിലേക്ക് കടക്കാം. ഫസ്റ്റ് ക്വസ്റ്റ്യൻ: വിച്ച് ഓഫ് ദ ഫോളോയിങ് ഡ്രഗ് ഹാസ് ടു ബി റെസ്ട്രിക്റ്റഡ് ഫോർ കോൺട്രാസ്റ്റ് ബേസ്ഡ് പ്രൊസീജിയർ? ഓപ്ഷൻസ് ആർ മെറ്റ്ഫോമിൻ, amlodipine, paracetamol and aspirin. Which of the following drug has to be restricted for contrast based procedure? And the answer is metformin, because metformin plus contrast result in lactic acidosis. So metformin is restricted for contrast based procedures. The next question: ileostomy leads to, the options are metabolic acidosis, metabolic alkalosis, respiratory acidosis and respiratory alkalosis. The ileostomy leads to, and the answer is metabolic acidosis. Ileostomy leads to metabolic acidosis because intestine contains large amount of bicarbonate. During ileostomy there is a chance of loss of bicarbonate and leads to metabolic acidosis. Next question: which of the following is termed as insulin shock? The options are hyperglycemia, pancreatitis, hypoglycemia and DKA, diabetic ketoacidosis. Which of the following is termed as insulin shock? And the answer is hypoglycemia. The next question: falsely high SpO2 reading is observed in, the options are cold extremities, hypovolemia, hypothermia and carbon monoxide poisoning. Falsely high SpO2 reading is observed in, and the answer is carbon monoxide poisoning. The next question: normal pulmonary artery wedge pressure. The options are 2 to 5 mm of Hg, 8 to 12 mm of Hg, 15 to 20 mm of Hg and 20 to 30 mm of Hg. Normal pulmonary artery wedge pressure. And the answer is 8 to 12 mm of Hg. Next question: a patient receiving continuous salbutamol nebulization therapy, the nurse assess for, the options are serum calcium, serum potassium, serum magnesium and serum sodium. A patient receiving continuous salbutamol nebulization therapy, nurse assess for, and the answer is serum potassium level, because salbutamol reduces the serum potassium level by increasing the shift of extracellular potassium into the intracellular space. So assess the serum potassium level of a patient receiving continuous salbutamol nebulization therapy. The next question: precautions used when caring for a rubella patient is, the options are droplet precaution, contact precaution, universal precaution and hand washing. Precautions used when caring for a rubella patient is, and the answer is droplet precaution, because the rubella virus transmitted through airborne droplets when infected people sneeze or cough. The next question: osmolarity of normal saline is, and the options are 134 MEq bar liter, 144 MEq bar liter, 154 MEq bar liter and 164 MEq bar liter. Osmolarity of normal saline, and the answer is 154 MEq bar liter. The next question: worker in ICDS program is, the options are Anganwadi worker, village health guide, health supervisor and multi-purpose workers. Workers in ICDS program, and the answer is Anganwadi worker. The next question: method used to give haloperidol injection. The options are M-track, Z-track, N-track and W-track. Method used to give haloperidol injection, and the answer is Z-track method. The next question, a child is not giving his toys to another. This type of play is, the options are parallel play, group play, social play and cooperative play. A child is not giving his toys to another. This type of play is, and the answer is parallel play. The next question, eligible couple registry is maintained at, the options are subcenter, PHC, CHC and FHC. Eligible couple register is maintained at, and the answer is subcenter. Eligible couple register is at, eligible couple എന്നാണ് നോക്കാം. Eligible couple is a currently married couple wherein the wife is in reproductive age, that is 15 to 49 years. The wife is in between 15 to 49 years. Next question, fresh bleaching powder contains, the options are 33% chlorine, 3.3% chlorine, 0.33% chlorine, 0.033% chlorine. Fresh bleaching powder contains, and the answer is 33% chlorine. And the next question, freshly prepared ORS should not be used after, the options are 6 hours, 12 hours, 18 hours and 24 hours. Freshly prepared ORS should not be used after, and the answer is 24 hours. Next question, decrease in the incidence of a disease to a level where it ceases to be a public health problem is, the options are control, elimination, eradication and surveillance. Decrease in the incidence of a disease to a level where it ceases to be a public health problem. And the answer is control. കൺട്രോളും എലിമിനേഷനും ഇറാഡിക്കേഷനും എന്താണെന്ന് നോക്കാം ഡീറ്റെയിൽ ആയിട്ട്. കൺട്രോൾ മീൻസ് റിഡക്ഷൻ ഓഫ് ഡിസീസ് ഇൻസിഡൻസ്, പ്രിവിലൻസ്, മോർട്ടാലിറ്റി, മോർബിഡിറ്റി ആൻഡ് ഡിസബിലിറ്റി ടു എ locally acceptable level, and elimination is reduction of infection and disease to zero in a defined area, but continued effort is required. Elimination means disease agent ഉണ്ട് but no incidence of disease, that is zero incidence by interrupting the transmission. നമ്മൾ എക്സാമ്പിൾ ആയിട്ട് പോളിയോനെ പറയാം. Next is eradication. Eradication is permanent reduction of worldwide incidence to zero as a result of deliberate intervention. Continuous effort is not required. No disease agent and no disease is present in eradication. നമുക്ക് എക്സാമ്പിൾ ആയിട്ട് സ്മോൾ പോക്സ് പറയാം. എലിമിനേഷൻ്റെ ഇറാഡിക്കേഷൻ്റെ കുറച്ച് ഡിഫറൻസ് പറയാം. Elimination is the reduction of a disease to a zero new cases in a geographical area. But in eradication is the permanent and complete worldwide reduction of to zero new cases of the disease. And in elimination, when a disease is eliminated, the disease is only absent in a certain geographical area. But in eradication, when a disease is eradicated, the disease is removed from the whole world. In elimination, preventive measures are necessary, but in eradication, preventive measures are not necessary. Example in elimination is elimination of measles in Sri Lanka, and eradication is worldwide eradication of chickenpox. And the next question, continuous scrutiny of factors that determine the occurrence and distribution of disease and other condition of ill health is the definition of, the options are monitoring, surveillance, disease control and system analysis. Continuous scrutiny of factors that determine the occurrence and distribution of disease and other condition of ill health is definition of, and the answer is surveillance. The next question, in Maslow's hierarchy of needs, which is considered as the most basic? The options are love and belonging needs, physiological needs, self-esteem needs and self-actualization needs. In Maslow's hierarchy of needs, which is considered as the most basic? And the answer is physiological needs. Maslow's hierarchy of needs നോക്കാം. ഒരു പിരമിഡിൻ്റെ 5 ലെവലായിട്ടാണ് മാസ്ലോ നമ്മുടെ നീഡ്സ് ഹയറാർക്കി ചെയ്തിട്ടുള്ളത്. അതിൽ ബേസിക് നീഡ്സ് ആർ 2, ദാറ്റ് ഈസ് ഫിസിയോളജിക്കൽ നീഡ്സ് ആൻഡ് സേഫ്റ്റി നീഡ്സ്. ഫസ്റ്റ് വൺ ഈസ് ഏറ്റവും ബേസിക് നീഡ് ഫിസിയോളജിക്കൽ നീഡ്സ് ആണ്, ഫുഡ്, വാട്ടർ, വാംത്ത് ആൻഡ് റെസ്റ്റ്. Next is safety needs. Safety needs including security and safety. Next is psychological needs. Psychological needs are 2. First one is belongings and love needs. And next is esteem needs. Under belongings and love needs, that is including intimate relationships and friends. Next is self-esteem needs, that including prestige, feeling of accomplishment. A top and higher level is self-fulfillment needs, that is self-actualization. Under that, achieving one's full potential including creative activities. This is all about Maslow's hierarchy of needs. The next question, one of the toxic symptoms to be watched for a patient getting digoxin. The options are peripheral edema, rashes, oliguria and bradycardia. One of the toxic symptoms to be watched for a patient getting digoxin. And the answer is bradycardia. Next question, which of the following is not necessary in the management of pulmonary edema? The options are oxygen at high flow rate, mechanical ventilation, diuretics and thoracentesis. Which of the following is not necessary in the management of pulmonary edema? And the answer is thoracentesis. The next question, largest cavity in the human body. The options are thoracic cavity, cranial cavity, abdominal cavity and pelvic cavity. Largest cavity in the human body, and the answer is abdominal cavity. The next question, the most common clinical finding associated with the cancer of the urinary bladder. The options are suprapubic pain, painless hematuria, dysuria, urinary retention. The most common clinical finding associated with the cancer of urinary bladder, and the answer is painless hematuria. The next question, it is the reward of labor for his contribution to the production activity. Options are interest, profit, rent and wage. It is the reward of labor for his contribution to the production activity, and the answer is wage. The next question, smallest unit of culture is. The options are complex, trait, morale and subculture. Smallest unit of culture is, the answer is trait. The next question, one of the best form of controlled thinking is. The options are imagination, reasoning, daydreaming and memorizing. One of the best form of controlled thinking is, and the answer is reasoning. The next question, the key for effective communication is. The options are listening, hearing, talking and sharing. The key for effective communication is, answer is listening. Next question, sour grape mechanism is a form of. The options are projection, rationalization, substitution and sublimation. Sour grape mechanism, that is kittata mundiri pulikku. It's a form of. The answer is rationalization. ഡിഫെൻസ് മെക്കാനിസം ആണിത്. അപ്പോൾ ഡിഫെൻസ് മെക്കാനിസം എല്ലാം ഇമ്പോർട്ടൻ്റ് ആണ്. നെക്സ്റ്റ് ക്വസ്റ്റ്യൻ, വൺ CKD patient on dialysis show changes in the ECG. Which of the following is most accurate investigation for MI? The options are TROP-T, TROP-I and myoglobin and LDH. One CKD, chronic kidney disease patient on dialysis shows changes in the ECG. Which of the following is most accurate investigation for MI? And the answer is TROP-I. നോർമൽ പേഷ്യൻ്റെ കാര്യമാണെങ്കിൽ TROP-T ആണ് ആക്യുറേറ്റ് ആൻഡ് TROP-I is specific. But in the case of CKD patient, TROP-T is always elevated. So TROP-I is reliable reading. The next question, flag sign is related to, the options are pregnancy, pancreatitis, kwashiorkor and psoriasis. Flag sign is related to, and the answer is kwashiorkor. Flag sign എന്താണെന്ന് നോക്കാം. Flag sign is the alternate bands of pigmented and hypopigmented areas in the skin, and that's seen in kwashiorkor. Kwashiorkor is malnutrition produced by severely inadequate amount of protein in diet. Protein deficiency in diet ആണ് kwashiorkor. മരാസ്മസും അങ്ങനെ ഒരു ഡെഫിഷ്യൻസി ഡിസോർഡർ ആണ്. പ്രോട്ടീൻ ആൻഡ് കലോറി ഡെഫിഷ്യൻസി ഈസ് മരാസ്മസ്. The next question, which of the following fluid is restricted for a patient with acute MI? The options are normal saline, ringer lactate, DNS and D5. Which of the following fluid is restricted for a patient with acute MI? And the answer is ringer lactate. The pathophysiological changes in the MI, changes of MI, myocardial infarction causes lactic acidosis, so RL should be restricted. The next question, which of the following is least significant vitals in emergency situation? The options are BP, pulse rate, temperature and respiratory rate. Which of the following is least significant vitals in emergency situation? And the answer is temperature. The next question, burns patient should receive an analgesics through, the options are IM route, IV route, oral route and subcutaneous route. Burns patient should receive an analgesics through, and the answer is IV route, because IM, subcutaneous and oral analgesics absorb unreliable following burn injury due to fluid shift and gastrointestinal stasis. So IV route is accurate. And next question, which of the following is an ototoxic drug? The options are atenolol, amlopryl, furosemide and metformin. Which of the following is an ototoxic drug? And the answer is furosemide. The next question, rifampicin is used for the prophylaxis of, the options are gonorrhea, malaria, leprosy and meningitis. Rifampicin is used as the prophylaxis of, and the answer is leprosy. A single dose rifampicin is used as a post-exposure prophylaxis of leprosy. Single dose rifampicin is used as PEP of leprosy. The next question, clay-colored stool is suggestive of, the options are amoebic dysentery, typhoid, ulcerative colitis and obstructive jaundice. Clay-colored stool is suggestive of, and the answer is obstructive jaundice. The next question, amount of voltage used in giving ECT is, the options are 200 to 250 volt, 150 to 180 volt, 50 to 80 volt and 70 to 130 volt. Amount of voltage used in giving ECT is, ECT means electric convulsive therapy, and the answer is 70 to 130 volt. Next question, surgical fusion of a joint is known as, the options are arthrodesis, arthroplasty, arthrotomy, nailing. Surgical fusion of a joint is known as, and the answer is arthrodesis. The next question, drug of choice for rheumatic fever is, the options are cephalosporin, penicillin, streptomycin and gentamicin. Drug of choice for rheumatic fever is, and the answer is penicillin. The next question, making up stories to fill in the gaps of memory is, the options are reaction formation, sublimation, confabulation and lying. Making up stories to fill in the gaps of memory. And the answer is confabulation. Example എന്ന് പറഞ്ഞാൽ ഒരു മെൻ്റലി ഇൽ പേഷ്യൻറ്റിനോട് നമ്മളൊരു എന്താ കഴിച്ചത്, രാവിലെ എന്താ കഴിച്ചതെന്ന് ചോദിക്കുകയാണ്. പേഷ്യൻറ്റ് പറയുന്നത് ദോശയാണ്, പക്ഷേ രാവിലെ ഒന്നും കഴിച്ചിട്ടുണ്ടാവില്ല പേഷ്യൻറ്റ്. അപ്പോൾ ഫാബ്രിക്കേറ്റഡ് ആയിട്ട് ആ ഗ്യാപ്പ് മെമ്മറി ഗ്യാപ്പ് ഫില്ല് ചെയ്യുകയാണ് പേഷ്യൻറ്റ്. അതാണ് കൺഫാബുലേഷൻ. നെക്സ്റ്റ് ക്വസ്റ്റ്യൻ, ട്യൂമർ ഓഫ് ബ്ലഡ് വെസൽ ഓഫ് ബ്രെയിനീസ്. ദ ഓപ്ഷൻസ് ആർ ഗ്ലയോമ, മെനിഞ്ചിയോമ, ഹിമാൻജിയോമ ആൻഡ് ആസ്ട്രോസൈറ്റോമ. Tumor of blood vessel of brain. The answer is hemangioma. The next question, the most important electrolyte of intracellular fluid. The options are potassium, calcium, sodium and chloride. Most important electrolyte of intracellular fluid is, and the answer is potassium, and most important electrolyte in extracellular fluid is sodium. The next question, which of the following refers to a graft derived from one part of a patient's body and used on another part of same patient? The options are heterograft, autograft, homograft and allograft. Which of the following refers to a graft derived from one part of a patient's body and used on another part of same patient? And the answer is autograft. Graftine പറ്റി ഡീറ്റെയിൽ ആയിട്ട് നോക്കാം. The graft derived from same individual is autograft, and graft from identical twins is synergenic graft, and graft from non-identical individual is allograft, and graft from different species is xenograft or heterograft. The next question, the most common area to develop bleeding in the hemorrhagic child is. The options are brain, joints, abdomen and pericardium. The most common area to develop bleeding in a hemorrhagic child is, and the answer is joints. The next question, total score of Glasgow scale. The options are 5, 10, 15 and 20. Total score of Glasgow scale. And answer is 15. Glasgow scale ഡീറ്റെയിൽ ആയിട്ട് നോക്കാം. Glasgow സ്കെയിലിൽ 3 പാരാമീറ്റേഴ്സ് ആണ് വരുന്നത്. ഐ ഓപ്പണിംഗ്, വെർബൽ റെസ്പോൺസ് ആൻഡ് മോട്ടോർ റെസ്പോൺസ്. ഇൻ ഐ ഓപ്പണിംഗ് 1 to 4 points and verbal response 1 to 5 points. Motor response is 1 to 6 points. In eye opening, if it is spontaneous, it's 4 mark. To sound is 3 mark. To pressure is 2 mark. None is 1 mark. And verbal response, oriented, if oriented is 5 mark. Confused is 4 mark. Inappropriate words is 3 mark. Inappropriate sound is 2 and none is 1. In motor response, if obeying commands is 6, localizing pain is 5, normal flexion 4, abnormal flexion is 3, extension is 2 and none is 1. And if it is 13 to 50, the total score is in between 13 to 15 is mild damage, and in 9 to 12 is moderate, and in 3 to 8 it is very severe. This is all about the Glasgow scale. The next question, in a pregnant woman, fundal height is at a level of syphilis sternum at, the options are 28 weeks, 32 weeks, 36 weeks and 40 weeks. In a pregnant woman, fundal height is at the level of syphilis sternum at, and the answer is 36 weeks. Fundal height in pregnant woman നോക്കാം ഡീറ്റെയിൽ ആയിട്ട്. At 12 weeks, fundus just above the pubic bone, and 14 to 16 weeks in between the pubic bone and umbilicus. At 20 weeks, the fundal height at umbilicus. At 32 weeks in between the umbilicus and syphilis sternum. At 36 to 38 weeks, at fundus is usually right up under sternum. And at in 14 weeks, it is fundus drops below 38 weeks level, as presenting part drop down into pelvis. അങ്ങനെ presenting part drop ചെയ്യുന്നതാണ് lightning. The next question, when a person is unconscious, the person is unable to, the options are hear voice, control elimination, breathe, react to painful stimuli. When a person is unconscious, the person is unable to, and the answer is control elimination. The next question, World No Tobacco Day is, the options are 5th June, 31st May, 26th January and 7th April. World No Tobacco Day is, the answer is 31st May. World No Tobacco Day is 31st May. The next question, what is the dilution of adrenaline available in unit? What is the dilution of adrenaline available in unit? The options are 1:10, 1:100, 1:1000, 1:10,000. Dilution of adrenaline, the answer is 1:1000. The next question, echolalia is an example of, the options are simple vocal tics, complex vocal tics, simple motor tics and complex motor tics. Echolalia is an example of, echolalia എന്താണെന്ന് നോക്കാം. Echolalia is the meaningless repetition of another person's spoken words. ഇതിൽ echolalia is an example of, and the answer is complex vocal tics. സിമ്പിൾ ആൻഡ് കോംപ്ലക്സ് വോക്കൽ ടിക്സും മോട്ടോർ ടിക്സും എന്താണെന്ന് നോക്കാം. സിമ്പിൾ ടിക്സ് എന്ന് പറഞ്ഞാൽ ഇൻവോൾവ് സൗണ്ട്സ് ആൻഡ് ഇൻ കോംപ്ലക്സ് ടിക്സ് മേ ഇൻവോൾവ് വേർഡ്സ്, ഫ്രേസസ് ഓർ സെൻറ്റൻസസ്. ഇൻ സിമ്പിൾ മോട്ടോർ ടിക്സ് ഐ ബ്ലിങ്കിങ്, jerking, shoulder shrugging, eye darting, finger flexing, striking the tongue out. ഇതൊക്കെയാണ് സിമ്പിൾ മോട്ടോർ ടിക്സ്. നെക്സ്റ്റ് സിമ്പിൾ വോക്കൽ ടിക്സ് നോക്കാം. ടച്ചിങ് ദ നോസ്, ടച്ചിങ് അതർ പീപ്പിൾ, സ്മെല്ലിംഗ് ഒബ്ജക്റ്റ്, ഒബ്സെൻസ് ജസ്റ്റേഴ്സ്, ഫ്ലാപ്പിംഗ് ദ ആംസ് ആൻഡ് ഹോപ്പിംഗ് അപ്പ് വരുന്നത്. ആൻഡ് കോംപ്ലക്സ് ടിക്സ് നോക്കാം. കോംപ്ലക്സ് ടിക്സ് വേർഡ്സ് ആവാം, ഫ്രേസസ് ആവാം, സെൻറ്റൻസസ് ആവാം. ആൻഡ് ഇൻ കോംപ്ലക്സ് മോട്ടോർ ടിക്സ് പിക്കഫിങ്, യെല്ലിങ്, ത്രോട്ട് ക്ലിയറിങ് ആൻഡ് ബാർക്കിംഗ് ഒക്കെയാണ് വരുന്നത്. ആൻഡ് ഇൻ കോംപ്ലക്സ് വോക്കൽ ടിക്സ് യൂസിങ് ഡിഫറെൻറ്റ് വോയിസ്, ഇൻറ്റോണേഷൻസ്, റിപ്പിറ്റേഷൻ ഓഫ് വൺസ് ഓൺ വേർഡ്സ് ഓർ ഫ്രേസസ് ആൻഡ് റിപ്പിറ്റേഷൻ ഓഫ് അതേഴ്സ് വേർഡ്സ് ഓർ ഫ്രേസസ്. ദാറ്റ് ഈസ് എക്കോലാലിയ വരുന്നത് അതിലാണ്. നെക്സ്റ്റ് ഈസ് ഒബ്സെൻസ് ലാംഗ്വേജ്. ഇതൊക്കെയാണ് കോംപ്ലക്സ് വോക്കൽ ടിക്സിൽ വരുന്നത്. ഇറ്റ്സ് ഓൾ അബൌട്ട് complex and simple motor and vocal tics. The next question, IQ level between 20 and 34 can be considered as, the options are educable, trainable, dependent and life support. The IQ level between 20 and 34 can be considered as, and the answer is dependent. MR patients inde IQ level classification നോക്കാം. First one is mild. Mild is known as educable. The IQ level is 50 to 70. Next one is moderate. That is called as trainable. The IQ level between 35 to 49. Next is severe. It's called as dependent. That is IQ level 20 to 34. The last one is profound. Profound need life support. That is IQ level is less than 20. The next question, golden color of amniotic fluid indicate, the options are fetal distress, RH incompatibility, post maturity and intrauterine death. Golden color of amniotic fluid indicate, the answer is RH incompatibility. The color of amniotic fluid and conditions നോക്കാം. First one is green. Green ആണെങ്കിൽ Mcq'S stained ആയിരിക്കും. Next one is greenish yellow. It is post maturity. And dark color seen in concealed accidental hemorrhage. And last one is dark brown seen in intrauterine death. The green in meconium, greenish yellow in post maturity, dark color in concealed accidental hemorrhage and dark brown in intrauterine death. The next question, what is the expected weight ratio of placenta and baby? The options are 1:4, 1:5, 1:8 and 1:6. What is the expected weight ratio of placenta and baby? And the answer is 1:6. The next question, sunset eyes seen in. The options are increased intracranial pressure, meningitis, hydrocephalus and delirium. Sunset eyes seen in. The sunset eyes means sclera visible above the cornea as seen in picture. The answer is hydrocephalus. Sunset eyes seen in hydrocephalus. The next question, false membrane is the characteristic feature of. The options are measles, diphtheria, TB and leprosy. False membrane as seen in picture. The false membrane is the characteristic feature of, and answer is diphtheria. The next question, water hammer pulse is seen in. The options are aortic stenosis, mitral stenosis, aortic regurgitation. Water hammer pulse എന്ന് പറഞ്ഞാൽ pulse that is bouncing and forceful, rapidly increasing and subsequently collapsing pulse ആണ് water hammer pulse. The water hammer pulse is seen in, and the answer is aortic regurgitation. The next question, tunica vaginalis is the covering tissue of. The options are blood vessels, liver, testis and vagina. The tunica vaginalis is the covering tissue of, and the answer is testis. The next question, the last sense that is believed to be remain intact up to the end of life. The options are touch, sight, smell and hearing. The last sense that is believed to be remain intact up to the end of life, and the answer is hearing. Question, fundal palpation of postpartum client shows it is displaced to right. What should be the next intervention? The options are ask the client to void, check BP and pulse rate, administer oxytocin, check for vaginal bleeding. Fundal palpation of postpartum client shows it is displaced to right. What should be the next intervention? And the answer is ask the client to void. The next question, which of the following vitamin deficiency is seen in a patient with liver disease? The options are vitamin B12, vitamin C, vitamin B9, vitamin A. Which of the following vitamin deficiency is seen in a patient with liver disease? And the answer is vitamin A. The fat soluble vitamin deficiency is seen in patient with liver disease. Vitamin A is fat soluble vitamin. So vitamin D deficiency is seen in patient with liver disease. The next question, what is the best and most accurate method of measuring the medication dosage for infants and children? The options are weight and height, normogram and height. What is the best and most accurate method of measuring the medication dosage for infants and children? And the answer is weight. The next question, the technique is used to open oxygen cylinder. The options are clockwise, anti-clockwise, upwards and downwards. The technique is used to open oxygen cylinder. Answer is anti-clockwise. Question, which of the following epithelium covers urinary bladder? The options are ciliated epithelium, cuboidal epithelium, columnar epithelium and transitional epithelium. Which of the following epithelium covers urinary bladder? And the answer is transitional epithelium. Types of epithelium and location and function നോക്കാം. First one is simple squamous epithelium. Location is lung alveoli and blood vessels. Function is allow small things to pass. Next is stratified squamous epithelium. The location is skin lining of mouth and esophagus, and function is protection against wear and tear. Next is simple cuboidal epithelium. Location is kidney tubules and function is mechanical support. Next is stratified cuboidal epithelium, seen in salivary and sweat glands, and function is mechanical support. Next is simple columnar epithelium, seen in lining of intestine and respiratory tract, and the function is absorption and secretion and moves mucus by cilia, that is ciliated. Next is stratified columnar. Location is male urethra and function is protection and secretion. Next is transitional epithelium. The location is lining of urinary bladder. The function is help in expansion and contraction. Next is pseudo stratified columnar epithelium. The location is in respiratory tract, and function is move mucus by cilia. It's all about epithelial tissue. Next question is, which type of pain causes change in vital signs? The options are acute pain, chronic pain, preferred pain, and cancer pain. Which type of pain causes change in vital signs? And the answer is acute pain. The next question, immunization is a method of, the options are primary prevention, secondary prevention, tertiary prevention, and barrier prevention. Immunization is a method of, answer is primary prevention. The next question, one of the earliest sign of cardiogenic shock is, the options are tachycardia, decreased urinary output, presence of S for heart sound, and altered level of consciousness. One of the earliest sign of cardiogenic shock. And the answer is tachycardia. The next question, mydriatics are drugs that, options are dilate pupils, constrict pupils, reduce intraocular pressure, and reduce blood pressure. Mydriatics are drugs that, and the answer is dilate pupil. The mydriatics dilate pupil and the myotics constrict the pupil. Mydriatics dilate and myotics constrict the pupil. Next question, third degree genital prolapse is otherwise called, the options are retroversion, inversion, prosidentia, and fibroid. Third degree genital prolapse is otherwise called, and the answer is prosidentia. Next question, tocolytic act on uterus to produce, the options are contraction, relaxation, retraction, and constriction. Tocolytics act on uterus to produce, and the answer is relaxation. Next question, malaria is transmitted by, the options are Aedes mosquitoes, Anopheles mosquitoes, Culex mosquitoes. Malaria is transmitted by, and the answer is Anopheles mosquito, that is female Anopheles mosquitoes. Different mosquitoes adinte transmit cheyna diseases nokam. First one is Aedes. The diseases are chikungunya, dengue fever, lymphatic filariasis, Rift Valley fever, yellow fever, and Zika. Next is Anopheles. Anopheles is malaria and lymphatic filariasis. Next is Culex. Diseases are Japanese encephalitis, lymphatic filariasis, and West Nile disease. Next question, which of the following position can be suggested for a patient with TOF and cyanosis? The options are high Fowler's position, 3-point position, squatting position, and sitting position. Which of the following position can be suggested for a patient with tetralogy of Fallot and cyanosis? And the answer is squatting position. The squatting position increases the venous return to heart. The next question, which part of the brain is considered as addict on alcohol? The options are cerebrum, cerebellum, thalamus, and hypothalamus. Which part of the brain is considered as addicted on alcohol? And the answer is cerebellum. Cerebellത്തിന് അഫക്റ്റ് ചെയ്യുന്നതുകൊണ്ടാണ് ആൽക്കഹോൾ കൺസ്യൂം ചെയ്ത പേഷ്യൻറ്റിന് ബാലൻസ് കൺട്രോൾ ചെയ്യാൻ പറ്റാത്തത്. ആൽക്കഹോൾ അഫക്റ്റ് സെറിബെല്ലം, സോ പേഷ്യൻറ്റ് കാൺ ബാലൻസ്. The next question, the condition which is termed as drowning in his own fluid. The options are cardiac failure, pneumonia, TB, and pulmonary edema. The condition which is termed as drowning in his own fluid. And the answer is pulmonary edema. The next question, which of the following should be monitored for a patient on Mcq'S as the treatment of PPH? The options are contraction rate, fetal heart rate, blood pressure and DTR. Which of the following should be monitored for a patient on Mcq'S as the treatment of postpartum hemorrhage? And the answer is blood pressure, because most common side effect of Mcq'S is hypertension. The next question, which of the following fluid is utilized to prime the blood transfusion set before infusion? The options are sterile water, normal saline, dextrose 5% and a ringer lactate. Which of the following fluid is utilized to prime the blood transfusion set before infusion? And the answer is normal saline. The next question, which of the following disease is otherwise called as Hansen's disease? The options are tuberculosis, diphtheria, leprosy and malaria. Which of the following disease is otherwise called as Hansen's disease? Answer is leprosy. Leprosy is called as Hansen's disease. The next question, Hartmann's operation is related to? The options are lung, heart, liver and colon. Hartmann's operation is related to? The answer is colon. Hartmann's operation related to colon. Hartmann's operation is surgical resection of rectosigmoid colon with closure of rectal stump and formation of an end colostomy. Rectosigmoid colon resect ചെയ്തിട്ട് ബാക്കിയുള്ള rectal stump close ചെയ്തിട്ട് ഒരു colostomy ഇടുക ചെയ്യുന്നത് Hartmann's operation. The next question, which of the following blood component therapeutically provide all the coagulation factors? The options are whole blood, fresh frozen plasma, cryoprecipitate and platelet rich plasma. Which of the following blood component therapeutically provide all the coagulation factors? And answer is FFP, that is fresh frozen plasma. Next question, CRP, that is C-reactive protein, is a substance produced during inflammation in the body. It is produced in, the options are kidney, bone marrow, liver and stomach. C-reactive protein is a substance produced during inflammation in the body. It is produced in, and the answer is liver. CRP produced in liver. The next question, the greatest danger of hyperkalemia is, the options are tetany, cardiac arrest and fluid overload and polyuria. The greatest danger of hyperkalemia is, answer is cardiac arrest. The next question, narcotics are not administered in patients with high cervical injury as they add risk of, the options are sedation, increased ICP, respiratory depression, drug dependence. Narcotics are not administered in patients with high cervical injury as they add risk of, answer is respiratory depression. The next question, which one of the following can precipitate an acute gouty arthritis? The options are emotional stress, lack of exercise, excess smoking and excess alcohol intake. Which one of the following can precipitate an acute gouty arthritis? Answer is excess alcohol intake. Next question, which among these reports are not permanent? The options are oral reports, written reports, service report, night reports. Which among these following reports are not permanent? The answer is oral reports. Oral reports are not valid. Next question, the highest level of learning is, the options are memory level, understanding level, reflecting level and cognitive level. The highest level of learning is, answer is reflecting level. Highest level of learning is reflecting level. The next question, father of cognitive development theory is, the options are Herbert Spencer, Socrates, Skinner, and Jean Piaget. Father of cognitive development theories. And the answer is Jean Piaget. The next question, good learning experience is, the options are learning by doing, classroom learning, time-bound learning, and self-learning. Good learning experience is, answer is learning by doing. The next question, planning stage in teaching is called, options are pre-active phase, interactive phase, post-active phase, and diagnostic phase. Planning stage in teaching is called, and the answer is pre-active phase. Next question, attitude of a student is assessed by, the options are checklist, analogy, rating scales, and assignments. Attitude of a student is assessed by, and the answer is rating scale. Next question, praise and blame is a form of, the options are intrinsic motivation, extrinsic motivation, self-actualization motive. Praise and blame is a form of, answer is extrinsic motivation. Next question, which among the following is a component of curriculum? Not a component of curriculum. The options are objectives, content, syllabus, and evaluation. Which among the following is not a component of curriculum? Answer is evaluation. The next question, the value or meaning to one's belief is, the value or meaning to one's belief is, the options are purpose, goal, philosophy, and ethics. Answer is philosophy. The next question, addition, deletion, and recognition of the curriculum is known as, the options are curriculum construction, curriculum revision, curriculum model, and curriculum evaluation. Addition, deletion, and recognition of curriculum is known as, the answer is curriculum revision. The next question, the formal line of authority and communication in an organization is called, the options are chain of command, responsibility, unity of command, and unity of direction. The formal line of authority and communication in an organization is called, answer is chain of command. The next question, the planned educational experiences provided in a job setting is, the options are curricular education, in-service education, primary education, and specialized education. The planned educational experiences provided in a job setting. Answer is in-service education. Next question, authority refers to, the options are right to use and abuse power, right to command, right to perform duty, right to grant rewards. Authority refers to, answer is right to command. The next question, the number of people directly reporting to any one manager or officer is known as, the options are span of control, staffing, scalar chain, and line organization. The number of people directly reporting to any one manager or officer is known as, the answer is line organization. Next question, coordination of the end of life care is termed as, the options are hospice management, palliative care, critical care, and tertiary care. Coordination of the end of life care is termed as, and answer is hospice management. The next question, professional negligence is legally termed as, the options are crime, assault, malpractice, and slander. Professional negligence is legally termed as, answer is malpractice. The next question, TQM, that is total quality management, refers to, the options are quality assurance, quality improvement, quality models. TQM, that is total quality management, refers to. The answer is quality improvement. Next question. A set of ethical principles accepted by all members of profession for practice is. Options are bioethics, code of ethics, law and regulations. A set of ethical principles accepted by all members of profession for practice is. Answer is code of ethics. The next question. What is the maximum length of time the nurse allow an IV bag of saline to infuse into the patient? The options are 6 hours, 12 hours, 18 hours and 24 hours. What is the maximum length of time the nurse allow an IV bag of saline to infuse into the patient? Answer is 24 hours. The next and last question. Chemical sterilant used for low temperature plasma sterilization. Options are silver nitrate, ethylene oxide, formaldehyde and hydrogen peroxide. Chemical sterilant used for low temperature plasma sterilization. The answer is hydrogen peroxide. അപ്പോൾ ഇത്രയാണ് ഇന്നത്തെ വീഡിയോ. ലെങ്ത് കുറച്ച് കൂടിപ്പോയെന്ന് തോന്നുന്നു. അപ്പോൾ താങ്ക് യു ഫോർ വാച്ചിങ്. പ്ലീസ് ലൈക്ക്, ഷെയർ ആൻഡ് സബ്സ്ക്രൈബ് മൈ വീഡിയോ. താങ്ക് യു.